MS is a chronic disease, and in chronic disease the adherence to the treatments are not very high. With any treatment that should be maintained on time, we must expect between 30 to 40% fault absent of good adherence. So it's important to make anything that can improve adherence, because if you don't have adherence, you don't have efficacy of the drugs. The RebiSmart is a very smart solution to a problem of adherence, because it gives the opportunity to first give an easy administration for the patients, because you can program the device for the injection, the speed of the injection, the depth of the injection. So the patients, particularly young patients, and most MS patients are young patients, control for these kind of devices, so they get an easier way to administer the drug. And the other thing is that the devices keeps the information on how many and when have you got your injection. So it gives you all the information inside, keeps all the information, so we can study later on, as we have done, what is the adherence of our patients. The design is very simple. The device must be changed every 3 years, every 36 months. So we decided to keep all these devices in the country, in Spain. So 29 hospitals, hospitals participating throughout all the country, keep those devices, and we analyze what was inside of these devices. How many injections, when, and what the amount of the drug had received the patient, to calculate the adherence of these patients. So we have the 100% the data of more than 200, almost 300 patients in 29 hospitals, which is a very good sample, and it's a very representative of the sample. The findings were very remarkable. 90% of the patients maintained adherence throughout 3 years, which is much superior that can be expected with any other type of administration. We have done previously studies on adherence, and we know that adherence is not that high. Adherence could be 60 to 70% in the best situations, and here we have attained 30% got 100%, and all the others got 90% of the drug that had to be administered, which is a very high figure, and that tells us that the RebiSmart, the device, is very useful to implement the drug, to receive the drug, and to maintain adherence. I think we will see more in the future of this kind of development to improve adherence, because, there is a simple thing. Drugs that are not taken don't function. So we better be sure that the patients are taking the drug we prescribe, for many reasons.